Nielsen, an individual with type 2 diabetes who comes from Denmark. Henning?
Yes, thank you. I would also start to thank you for inviting me here and giving me the opportunity to tell about my thoughts and my experience since I was diagnosed with diabetes. I'm born back in 1957 and was diagnosed with type 2 diabetes in 2003. At that time, neither I or anybody near me knew anything about that type 2 diabetes was very much related to inheritance. I'm, by the way, third generation with type 2 diabetes. And if I have anything to say, it stops with me. None of my kids should inherit this disease. I know they have probably the genes. So the only thing I can change is to tell them to avoid all the risks, getting overweight, too little exercise, eating the wrong things, stuff like that. I can also tell you I was educated as a Bachelor of Science, work as an electrical engineering. About my disease, I was from the beginning treated with medicine. I was always already so advanced in my disease that I needed medication to control my blood sugar. I started with metformin and something to regulate my blood pressure. I can say my blood pressure is really under control now. I have no problems with lipids, but the problem is the blood glucose. I have varied over the years the medication and started on insulin for about 5 or 6 years ago on basis insulin, but for about 1 to 2 years ago, I changed and got on 5 times insulin a day, 2 times with basis insulin and rapid insulin for the meals. It works. It's not perfect. I think I have the same problem as everybody else. And Anne-Marie, you told me that you had the problem. You didn't know what type you was. At the time I was going to be treated with 2 types of insulin, I had the same discussion with my GP. And he actually said to me, we can take a test for you. I thought about it for a little while, and then I said to him, what difference does it make to me? Does it change your treatment of me? Can I have a new medicine or anything? And he said, no, probably not. Then I said, don't waste the money on that. So I'm still type 2 diabetic, even though I might not be it. And I don't care. Because I have a treatment that most of the time works, and that's the most important thing for me. I also recognize that a lot of people would like to have this here diagnosed. In Denmark, some people call it type 1.5, the LADA. But that's, in my opinion, due to the fact that they fear the judgment of other people. At least back in Denmark, it's still regular that people come to you and say, okay, you have type 2 diabetes, it's your own fault, live with it. Even though we know nowadays, yes, I have something to do about it, but it's not entirely my fault. So, this brings me to talk about what are my needs and challenges in my daily life. First of all, I would say, opposite the type 1, the needs or challenges have changed since I was diagnosed. Once I was diagnosed, I was given a metformin, took it, and then went to the doctor 3 months later, and he checked my blood glucose. That's all. I didn't have anything to check for myself. It worked. It was nice. Well, as long as it worked. With the added medication that could bring down the blood sugar, give low blood sugar levels, also came the need of measuring the blood sugar. I wouldn't say I have tried all glucose meters on the market. I haven't, but I have tried a lot. And I haven't found the ideal one yet. I might be able to combine them from some of those I have, but, well, this again brings me to the biggest fear I have, because shortly after having insulin, I experienced my first hypo. It's not pleasant. Waking up at night, very sweaty all over. And first time, I didn't know what to do. I realized it was my blood sugar level, measured it, and said, okay, you need something to eat. I ate something. I still felt bad. I ate something more. And the result, too high blood sugar level the entire next day. I don't know, doesn't everybody know that, or am I the only one? Okay, thank you. I think I speak for most diabetics, type 1, type 2, that the biggest fear we have is the low blood sugar. Because, as the young gents down there said, you can collapse. You can, risk never wake up again. So anything here that can help us reduce that risk, either by giving us a warning, and preferably without having to measure our blood sugar, because we may not realize we are low. So this needs to be done without that. Another need I have is during this year, should we say, travel by transforming medicine. I had periods where my GP wanted 6, 7, 8 measurements per day in a booklet or a table or anything. And I found the only solution at that time was a piece of paper and a pen. And it's tedious to wear that around. Please give us something else. The problem is, if you have a regular life, that means you get up in the morning, eat breakfast at the same time every day, you eat lunch at the same time, you eat your supper at the same time, then many meters can do this for you. But I don't know, my life is not that perfect, because then my lunch is shifted by an hour. In the weekends, I don't get up the same time I do at the working days. I get up 2 hours later, maybe. So I have to do it manually. Well, yes. I have also something to say about why it's important to be involved. I'm afraid much of what I have told is what all the others have already told you before. I have discussed that with others. I have similar experience, so I'm afraid I have nothing new to tell you. But like the previous speakers say, no, previous again, sorry, Chris, you need to tell us what trials are out there. And even for a type 2 diabetic, there are another challenge, because either the medication is for people who don't take any medicine, or for people who take only one kind of medicine, or whatever. And so far, I haven't been able to match those criteria. But another reason could also be, I haven't seen the trials. So like you say, Chris, we don't see them. I don't know about that. I can occasionally read about it in the papers, but nothing that is, should we say, fed to me. So this is very important. And this is actually my closing remarks, is that if I had the opportunity to participate in any kind of research or development of any devices, I would happy participate. I would happy spend the time giving you the reports you need, because I know reporting is a vital part of research. And the reason is, like Chris said, it's relevant for me. If it can give me a better daily life, quality of life. It may not affect my family, but if it can make life easier for me, I'm in. I'm all yours. Yes, that's all I have to say. Thank you.
So we have time now for